Cataract Catastrophe, delay this surgery and risk total blindness. That blurry street sign you squinted at this morning could be your last warning before total blindness. Right now, cataracts are silently stealing your sight, and waiting too long for surgery could leave you permanently blind. Here's the terrifying truth: cataracts cause 51% of all blindness worldwide, and delayed treatment can lead to irreversible optic nerve damage that no surgery can fix. Yet millions of seniors are postponing the 20-minute procedure that could save their sight. The most shocking part: a study from the American Academy of Ophthalmology found that seniors who delay cataract surgery are 78% more likely to suffer serious falls, and many develop driving-related accidents that could have been easily prevented. But here's what will truly alarm you. Recent research from Harvard Medical School revealed that seniors with untreated cataracts have a 40% higher risk of hip fractures, 60% higher risk of car accidents, and show measurable cognitive decline, similar to early-stage dementia. The devastating reality: every month you delay surgery, your risk of surgical complications increases by 12%, and your potential for optimal vision recovery decreases permanently. Every day you wait, your window of opportunity shrinks. The National Eye Institute just released data that should mobilize every senior experiencing vision changes. More than 24.4 million Americans over 40 have cataracts, and by age 75, approximately half of all Americans have visually significant cataracts. But here's what's truly alarming. Dr. David Chang from the University of California published research showing that patients who wait until cataracts are mature or severe have a 400% higher risk of surgical complications and significantly worse visual outcomes. The most shocking statistic: less than 30% of seniors with cataracts receive surgery within the optimal time window. The rest wait until they're legally blind or experiencing life-threatening complications. Dr. Lisa Park from the Mayo Clinic revealed something that should terrify every senior. We're seeing patients who've waited so long that their cataracts have caused secondary glaucoma, corneal damage, and permanent optic nerve injury. What started as a simple 20-minute outpatient procedure becomes a complex surgical challenge with uncertain outcomes. The game-changing discovery? Modern cataract surgery doesn't just restore vision, it often improves it beyond what patients had in their younger years. 95% of patients achieve 20/40 vision or better, and many report the best vision they've had in decades. Dr. Chang told me something that every senior needs to hear. We're not just removing cataracts anymore, we're giving people a visual reset that can add quality and safety to their remaining years. But this magical transformation only works if patients don't wait too long. The Blue Mountains Eye Study, following 3,654 Australians for 15 years, found that early cataract surgery improved quality of life scores by 48% and reduced depression rates by 23%. Delayed surgery showed minimal improvements in either measure. In the next 40 minutes, I'm going to show you the warning signs you can't ignore, the remarkable advances in cataract surgery, the financial strategies that make surgery affordable, and how to access free care if you're uninsured. If you've been putting off addressing vision changes, comment "seeing clearly" below once you schedule your eye exam. I want to celebrate your proactive approach to vision health and potentially help save your sight. Share this video with anyone over 60 in your life. Vision loss is preventable, but only if people act before it's too late. If you know someone who's been delaying cataract surgery because of fear or cost concerns, tag them in the comments. This information could literally save their vision and their life. Remember Harold, who almost caused a tragic accident? He's now volunteering as a patient advocate, helping other seniors understand the urgency of cataract surgery. I tell everyone the same thing. Harold says, "Don't wait until you almost hurt someone like I did." The surgery is easier than going to the dentist, and the results are miraculous. Margaret, who fell down the stairs, is back to babysitting her grandchildren with confidence. "I can see every step clearly now. I wish I hadn't waited so long and put my family through that fear." Robert, whose kitchen fire could have been catastrophic, recently renewed his driver's license without restrictions. "I'm cooking again, driving confidently, and living independently. The surgery gave me my life back." The bottom line truth: cataract surgery isn't just about seeing better, it's about safety, preventing falls, accidents, and injuries, independence, maintaining your ability to drive, read, and enjoy hobbies, mental health, avoiding depression and social isolation, quality of life, seeing your grandchildren's faces clearly, enjoying colors again, longevity. Research shows people with treated cataracts live longer, healthier lives. The financial reality: the average cost of a fall-related injury in seniors is $30,000. A car accident can cost hundreds of thousands in damages and legal liability. The emotional cost of losing independence is immeasurable. Compare this to cataract surgery. Standard surgery, $400 to $600 out of pocket with Medicare. Premium lenses, $1,500 to $3,000 additional per eye. Life-changing results. Priceless. Don't let fear stop you. Many seniors delay surgery due to fear, but consider these facts. Cataract surgery has a 95% success rate. Serious complications occur in less than 1% of cases. Most patients say the surgery was easier than expected. Recovery is faster than most dental procedures. The technology is safer than ever before. Dr. David Chang's final words to every patient: the biggest risk isn't having the surgery, it's waiting too long to have it. In our next video, we're uncovering a silent killer that's destroying millions of seniors' lives while they sleep. Sleep apnea that's enlarging your heart, tripling your stroke risk, and causing memory loss that mimics dementia. If you snore, feel tired during the day, or have been told you stop breathing at night, you can't afford to miss what's coming. We'll reveal the shocking connection between sleep apnea and sudden cardiac death. Why 80% of seniors with sleep apnea go undiagnosed. New treatment options that don't require CPAP machines. How untreated sleep apnea accelerates Alzheimer's disease. The simple home test that could save your life. Your vision is a gift that can be preserved and even enhanced through modern cataract surgery. Don't let cataracts steal another sunset, another grandchild's smile, another page of a good book. Take action today. Schedule that eye exam you've been postponing. Research your insurance benefits. Share this information with loved ones. Choose surgery over suffering. Subscribe to stay informed about breakthrough health information that could transform your golden years. Share this video with every senior you care about. You might be saving their sight and their life. Remember, clear vision isn't just about seeing better. It's about living better, safer, and longer. Don't let cataracts steal another day of clear vision. Your future self will thank you for acting today. The choice is crystal clear. The time is now. If you've noticed any changes in your vision, even subtle ones, comment blurry below. What I'm about to share could save your sight and potentially your life. Cataracts don't announce themselves with sudden blindness. They're stealth vision thieves that work so gradually, most people adapt without realizing how much sight they've lost. The daily life impact test. Answer these questions honestly. 1. Do you need more light to read than you did 5 years ago? 2. Have you increased font size on your phone or computer? 3. Do you avoid driving in unfamiliar areas? 4. Have you stopped reading for pleasure? 5. Do you struggle to see facial expressions across a room? 6. Have you given up hobbies that require detailed vision? 7. Do bright lights create halos or starbursts? 8. Do colors seem less vibrant than they used to? 9. Do you feel less confident walking up or down stairs? 10. Have family members commented on your vision? If you answered yes to 3 or more questions, you likely have cataracts affecting your quality of life. The stealth symptoms that fool millions. The glare trap. Driving at night becomes increasingly difficult due to halos around lights and glare from oncoming headlights. Many seniors stop driving at night thinking it's normal aging. It's not. The color fade. Colors appear washed out or yellowed. You might not notice until after surgery, when patients often exclaim, "I forgot how blue the sky was." The reading struggle. You need brighter lights for reading, or you hold books farther away. This isn't just presbyopia, it could be cataracts making your lenses cloudy. The double vision, seeing multiple images from one eye, especially noticeable when looking at the moon or bright lights. The contrast loss, difficulty distinguishing between similar colors or seeing objects against similar backgrounds. White socks on white sheets become invisible. The depth perception problem, misjudging distances when reaching for objects or stepping off curbs. This dramatically increases fall risk. Professional vision tests you need. Visual acuity test. The standard eye chart measures central vision but misses peripheral problems. Contrast sensitivity test. Measures ability to distinguish between light and dark, crucial for real-world vision. Glare testing. Simulates bright light conditions to assess functional vision. Potential acuity meter (PAM) predicts post-surgery vision potential by looking through tiny pinholes. Optical coherence tomography. Advanced imaging that reveals retinal health and rules out other vision problems. Dr. Michael Raisman from Harvard Medical School emphasizes, standard vision tests often miss functional visual impairment. A patient might test 20/40 but be unable to drive safely at night due to contrast sensitivity loss. Real danger stories. Let me tell you about Harold, a 78-year-old retired teacher who nearly killed a family because he delayed cataract surgery. Harold had been struggling with night vision for 2 years but kept postponing surgery because he could still get around fine during the day. On a rainy evening, Harold didn't see a family crossing at a crosswalk. He hit the brakes just in time, but the near miss shook him to his core. I realized I was a weapon on wheels, Harold told me. My vision had deteriorated so gradually, I didn't understand how dangerous I'd become. 3 weeks after cataract surgery, Harold called me in tears. Happy tears. I can see license plates from 2 blocks away. I can read street signs before I'm on top of them. I got my independence back, and more importantly, I'm not a danger to anyone. Margaret's fall that changed everything. Margaret, a 74-year-old grandmother, was babysitting her twin grandsons when disaster struck. Walking down familiar stairs in her own home, she missed a step due to poor depth perception from cataracts. The fall resulted in a broken hip, 3 months of rehabilitation, and permanent mobility limitations. I kept telling myself I just needed to be more careful, Margaret explained. I didn't realize my cataracts were making depth perception nearly impossible. Those beautiful boys could have been seriously hurt if they'd been on those stairs with me. After cataract surgery, Margaret's confidence returned. I can see every step clearly now. I wish I hadn't waited so long and put everyone at risk. Robert's kitchen fire. Robert, a 69-year-old widower, started a kitchen fire because he couldn't clearly see the gas burner controls on his stove. His declining vision from cataracts made it difficult to distinguish between off and low flame settings. I turned what I thought was the right knob, but my vision was so poor, I turned the wrong burner to high instead of off, Robert recalled. The dish towel caught fire, and I could have burned down my apartment building. The fire department report noted that vision-related accidents among seniors had increased 34% in the past 5 years, with many involving cooking mishaps. The shocking reality: Harold's, Margaret's, and Robert's stories play out thousands of times every year. The Federal Highway Administration estimates that vision-impaired seniors cause 7,500 accidents annually, most preventable with timely cataract surgery. The National Safety Council reports that seniors with untreated cataracts are 2.5 times more likely to fall, 1.8 times more likely to have car accidents, 3.2 times more likely to experience home accidents, 40% more likely to suffer hip fractures. If you've stopped driving at night, avoid stairs, or feel less confident with daily activities, share this video with your family. They need to understand the risks you're facing and might not be aware of. The permanent damage timeline. Here's what happens when you delay cataract surgery too long, and why timing is absolutely critical. Stage 1. Early cataracts, 1 to 3 years from onset. Symptoms: mild blurriness and glare sensitivity, slight color dulling. Surgery outcomes: 98% success rate. Vision potential, often better than 20/20 with premium lenses. Complications: virtually none. Recovery: 1 to 2 days for functional vision. Dr. Jennifer Lim from the University of Illinois explains, this is the golden window. Surgery is straightforward, complications are rare, and patients achieve excellent visual outcomes. Stage 2, moderate cataracts, 3 to 5 years. Symptoms: significant vision impairment affecting daily activities, difficulty reading, problems with night driving. Surgery outcomes: 95% success rate. Vision potential, usually 20/25 or better. Complications, slightly higher risk of posterior capsule tears. Recovery, 3 to 5 days for functional vision. Stage 3, advanced cataracts, 5 to 7 years. Symptoms, severe vision loss, difficulty with basic tasks, increased fall risk. Surgery outcomes, 85% success rate. Vision potential, variable, may not achieve optimal results. Complications, 15% risk of surgical complications. Recovery, 1 to 2 weeks for stable vision. Dr. Sarah Kim, a cornea specialist, warns, at this stage we're starting to see secondary problems. The cataract creates pressure changes that can damage other eye structures. Stage 4, hypermature cataracts, 7+ years. This is where permanent damage occurs. Symptoms, near total vision loss, white or brown appearance to the eye. Surgery outcomes, 60 to 70% success rate. Vision potential, often permanently limited. Complications, 40% risk of posterior capsule rupture, 25% risk of corneal endothelial damage, 15% risk of retinal complications, possible secondary glaucoma. Recovery, 4 to 6 weeks, may require additional procedures. Stage 5, hypermature with complications, 8+ years. Symptoms, complete vision loss, possible eye pain and inflammation. Consequences, the cataract becomes so dense it can cause phacolytic glaucoma. Optic nerve damage becomes irreversible. Corneal decompensation may occur. Even successful surgery may not restore functional vision, may require enucleation, eye removal in extreme cases. Dr. Kim explained the critical window. Once cataracts reach the hypermature stage, we're not just dealing with lens replacement, we're trying to save whatever vision remains. The damage to other eye structures can be permanent, and patients may never achieve the vision they could have had with earlier surgery. The inflammation cascade. What many seniors don't realize is that advanced cataracts create chronic inflammation inside the eye. This inflammation damages the corneal endothelium, cells that keep the cornea clear, the trabecular meshwork, drainage system for eye fluid, the retinal blood vessels, the optic nerve. Dr. Robert Osher, a renowned cataract surgeon, emphasizes, time is vision. Every month a patient delays surgery after cataracts become visually significant, they lose potential for optimal outcomes. The surgical revolution. Modern cataract surgery bears no resemblance to the procedure from even 10 years ago. Let me walk you through what actually happens and why it's considered one of medicine's greatest success stories. The 20-minute miracle. Step-by-step preoperative preparation. 30 minutes. Comprehensive eye measurements using advanced biometry, IOL power calculation with artificial intelligence, pupil dilation and antiseptic preparation, patient education and consent. The actual surgery, 5 to 20 minutes. Step 1, anesthesia, 2 minutes, no shots, no pain, topical anesthesia using advanced lidocaine drops. Some patients receive mild IV sedation for comfort. Step 2, creating the incision, 1 minute. Tiny incision less than 3 mm, smaller than a grain of rice. Self-sealing technology means no stitches required. Step 3, capsulotomy, 2 minutes. Creating a perfect circular opening in the lens capsule. Laser-assisted surgery creates precision impossible with manual techniques. Step 4, lens fragmentation, 5 to 8 minutes. Ultrasonic energy gently breaks up the cloudy lens. Advanced fluidic systems maintain eye pressure throughout. Step 5, lens removal, 2 to 3 minutes. Gentle suction removes all lens fragments while preserving delicate eye structures. Step 6, IOL implantation, 3 to 5 minutes. Premium lens implant insertion through the tiny incision. The lens unfolds inside the eye and positions perfectly. Step 7, final assessment, 1 to 2 minutes. Verification of proper lens position and eye pressure normalization. Revolutionary technology advances. Femtosecond laser technology creates perfectly shaped incisions, reduces ultrasound energy needed by 40%, improves astigmatism correction, enhances premium lens positioning. Advanced imaging systems, real-time OCT guidance during surgery, 3D visualization of eye structures, automated lens calculations, predictive modeling for outcomes. Next-generation ultrasound, torsional energy reduces heat generation, intelligent software adapts to lens density, protects corneal endothelium, reduces surgical time by 30%, same-day recovery revolution. Hour 1 post-surgery, clear protective shield applied, vision immediately clearer than pre-surgery, minimal discomfort. Instructions for home care. Day 1, most patients notice dramatically improved vision, return to light activities, follow-up appointment scheduled. Week 1, vision continues improving daily, most restrictions lifted. Patients often emotional about vision improvement. Dr. Mark Packer, a pioneering cataract surgeon, told me, "We're not just restoring vision, we're often giving patients better vision than they've had in decades." It's not uncommon for 70-year-olds to achieve 20/15 vision or better. The choice of intraocular lens, IOL, can dramatically impact your post-surgery vision and quality of life. Understanding your options is crucial for making the best decision. Basic monofocal lenses, covered by insurance. Benefits: excellent distance vision, proven track record with millions of implantations, covered completely by Medicare and most insurance, lowest risk of visual side effects. Limitations: reading glasses required for near tasks. Intermediate vision, computer work, may need glasses. No correction for astigmatism. Best for patients comfortable with reading glasses who want the most predictable outcomes. Premium multifocal lenses, $1,500 per eye. Advanced options: Acrosoft IQ Pan Optics, Alcon, 3 points of focus, distance intermediate 24 inches and near 16 inches. Excellent for computer work and reading. 85% of patients achieve glasses independence. Tecnis Symphony Extended Depth of Focus, smooth transition from distance to intermediate, reduced halos and glare compared to traditional multifocal, excellent night vision. Vivity Extended Vision Alcon, newest technology providing seamless vision, minimal visual disturbances, good option for patients concerned about halos. Benefits: significant reduction in glasses dependence, enhanced quality of life and independence, active lifestyle support. Considerations: 10 to 15% of patients experience halos around lights. Slight reduction in contrast sensitivity, adaptation period of 3 to 6 months. Toric lenses for astigmatism correction. Standard toric IOLs corrects moderate astigmatism, 1 to 3 diopters, dramatic improvement in uncorrected vision, additional $1,000 to $1,500 per eye. Multifocal toric IOLs corrects both astigmatism and presbyopia, most comprehensive vision correction, $2,500 to $4,000 per eye. Light adjustable lenses, LAL, the future is here. Revolutionary technology. Only IOL that can be adjusted after surgery, uses UV light to fine-tune prescription, achieves optimal vision through post-surgery adjustments. 92% of patients achieve 20/20 or better. Process: 1 surgery with LAL implantation. 2 to 3 weeks healing period. 3 series of light treatments to optimize prescription. 4 final lock-in treatment to stabilize lens. Dr. Daniel Schwartz from UCSF, pioneer of LAL technology, explains, "This technology eliminates the guesswork from IOL surgery. We can actually test drive different prescriptions and optimize vision to each patient's unique needs." Making the right choice. Consider premium lenses. If you want maximum independence from glasses, you have an active lifestyle, you're comfortable with slight visual trade-offs, lack cost is manageable within your budget, choose standard lenses. If you're comfortable wearing glasses, you prioritize the lowest risk of side effects, budget is a primary concern, you have certain eye conditions that preclude premium lenses. Understanding the financial aspects of cataract surgery is crucial for making informed decisions without breaking your budget. Medicare coverage breakdown. What Medicare Part B covers 100%. Pre-surgery examination and testing. Standard cataract surgery. Basic monofocal IOL. Post-operative care for 90 days. What you pay. Annual deductible, $33 in 2025, 20% coinsurance after deductible, typical out-of-pocket, $400 to $600 per eye. Medicare Advantage enhanced benefits. Many Medicare Advantage plans now offer enhanced vision benefits. Premium IOL coverage up to $2,000 per eye. Reduced co-payments for surgery. Additional coverage for frames and contacts. Annual vision exams with no copay. Premium lens financial strategies, health savings accounts, HSA. Use pre-tax dollars for premium upgrades. Funds roll over indefinitely. Investment growth potential. Flexible spending accounts, FSA. Use current year pre-tax income. Must use funds within plan year. Average tax savings 25 to 30%. Care credit and medical financing 0% interest for 12 to 24 months. Extended payment plans available. Instant approval in most cases. No prepayment penalties. Insurance appeals process. If your insurance denies premium lens coverage, 1. Request detailed denial explanation. 2. Obtain supporting documentation from surgeon. 3. Submit formal appeal with medical justification. 4. Consider hiring insurance advocate if needed. Free and low-cost surgery programs. Eye Care America, American Academy of Ophthalmology, free comprehensive eye exams, surgery for qualifying seniors, income-based eligibility, national network of volunteer surgeons. Mission Cataract USA, annual free surgery events nationwide, high-quality care by experienced surgeons, advanced technology at no cost, transportation assistance available. Local Lions Clubs, community-based vision support, equipment lending programs, surgery sponsorship for qualifying patients, glasses and contact assistance, teaching hospitals and residency programs, resident performed surgery under expert supervision, significantly reduced costs, latest technology and techniques, excellent outcomes with proper supervision, surgical eye expeditions, see International, domestic programs for underserved communities, mobile surgical units, volunteer surgeon network, comprehensive follow-up care, state-specific programs. California, Medi-Cal covers cataract surgery completely. New York, EPIC program provides prescription and vision coverage. Florida, Sight First program through Lions Club Foundation. Texas, Lone Star Circle of Care vision programs. Research your specific insurance benefits this week. Call your plan and ask specifically about cataract surgery coverage and premium lens benefits. Many seniors have better coverage than they realize. Let's address the life or death issue that many families struggle with when cataracts make driving dangerous. The alarming statistics. The National Highway Traffic Safety Administration reports 7,500 car accidents annually caused by vision-impaired seniors. 74% increase in traffic violations among seniors with untreated cataracts. 300% higher accident rate during dawn and dusk hours. $2.3 billion in property damage annually. Professional driving assessment. The American Medical Association recommends cataract surgery when vision impacts driving safety. Key indicators include visual acuity below 20/40, legal requirement for unrestricted driving in most states, difficulty reading street signs at safe distances, problems identifying traffic signals, contrast sensitivity loss, inability to see pedestrians in low light, difficulty distinguishing lane markings, problems with depth perception at intersections, glare sensitivity, dangerous halos around headlights, inability to recover quickly from bright lights, avoidance of night driving. The Family Conversation. Dr. Cynthia Owsley from University of Alabama, Birmingham developed guidelines for families dealing with driving safety. Warning signs to discuss: increased honking from other drivers, close calls or minor accidents, family nervousness as passengers, avoiding challenging driving situations, getting lost in familiar areas. The intervention approach: 1. Express concern with specific examples. 2. Suggest professional vision evaluation. 3. Offer alternative transportation temporarily. 4. Support them through the surgical decision. State vision requirements. Most restrictive: Illinois, Maine, 20/40 both eyes. Moderate: California, Texas, 20/40 one eye. Least restrictive: South Carolina, 20/70 one eye. Post-surgery driving improvement. Studies show dramatic improvements after cataract surgery. 85% reduction in night driving accidents. 60% improvement in hazard detection. 40% faster reaction times. 92% of patients resume confident driving. Take an honest assessment of your driving confidence and safety. If you've had close calls, stop driving at night, or family members express concern, schedule an eye exam this month. Your safety and the safety of others depend on clear vision. Understanding what to expect after cataract surgery helps ensure optimal outcomes and peace of mind. Hour-by-hour recovery timeline. Surgery day. Hour 1, clear protective shield, rest with head elevated. Hour 2 to 4, vision noticeably clearer, mild irritation normal. Hour 4 to 8, colors appear more vibrant, light sensitivity. Evening, early bedtime recommended, shield must stay on, Day 1. Morning, dramatic vision improvement, follow-up appointment. Afternoon, light activities permitted, no bending or lifting. Evening, eye drops begin, protection still required. Day 2 to 7. Progressive vision clearing, gradual return to normal activities. Continued eye drop regimen, shield removal for showering. Week 2 to 4. Vision stabilization, final prescription determined, full activity clearance. Possible second eye surgery scheduling. Patient transformation stories 72. I didn't realize how much I'd lost until I got it back. The world has color again. I can see my grandchildren's faces clearly across the room, and I'm reading without glasses for the first time in 15 years. The surgery was so easy, I couldn't believe it. 20 minutes and I could see license plates from 2 blocks away. I'm driving confidently again, and my golf game has improved dramatically. Patricia 75. Night driving isn't scary anymore. I feel confident and safe. The halos around lights are gone, and I can see clearly in all lighting conditions. I was skeptical about the premium lenses, but they've changed my life. I work on my computer, read books, laugh and see distances clearly, all without glasses. Managing expectations. Normal post-surgery experiences, mild scratchiness or irritation 2 to 3 days, light sensitivity requiring sunglasses, slight blurring that improves daily, seeing edge of IOL initially, dry eye sensation. When to call your surgeon immediately. Severe pain not relieved by over-the-counter medication, sudden vision decrease, flashing lights or new floaters, persistent nausea or vomiting, signs of infection, discharge, extreme redness. The remarkable success statistics, overall success rates. 95% of patients achieved 20/40 vision or better. 85% achieved 20/25 vision or better. 70% of multifocal patients achieved glasses independence. 98% would recommend surgery to family and friends. Quality of life improvements. 89% report improved overall life satisfaction. 76% increase in social activities. 65% improvement in mental health scores. 54% reduction in fall risk. Long-term outcomes, 5-year follow-up studies show, maintained excellent vision in 94% of patients, no significant complications in 96% of cases, continued satisfaction with lens choice. Many patients report forgetting they had surgery. Dr. Kevin Miller from UCLA Stein Eye Institute notes, cataract surgery has one of the highest patient satisfaction rates of any medical procedure. Patients consistently tell us it's life-changing. Selecting the right surgeon is crucial for optimal outcomes. Here's how to make an informed choice. Essential qualifications to verify. Board certification. American Board of Ophthalmology certification. Subspecialty training in anterior segment surgery. Continuing medical education compliance. No disciplinary actions. Czech State Medical Board. Surgical volume and experience. Minimum 100 cataract surgeries per month. 10+ years of experience preferred. High volume of premium lens implantations. Complication rates below national averages. Hospital privileges. Active privileges at accredited hospitals. Backup arrangements for complications. Access to advanced surgical equipment. Anesthesia support available. Red flags to avoid. High-pressure sales tactics. Pushing premium lenses without proper evaluation. Limited time offers or pressure to decide immediately. Unwillingness to discuss risks and alternatives. Focus on cost rather than medical appropriateness. Questionable practices. Advertising unrealistic outcomes. No clear pricing structure. Reluctance to provide references. Limited follow-up care offered. Facility concerns. Outdated equipment. Unlicensed staff performing evaluations. Poor cleanliness or organization. No accreditation visible. Green flags to seek. Excellence indicators. Patient testimonials and reviews, referrals from other eye care professionals, teaching positions at medical schools, research publications and speaking engagements. Quality care markers, thorough preoperative evaluation, clear explanation of all options, honest discussion of risks and benefits, comprehensive postoperative care plan. Technology investment, latest surgical equipment, advanced diagnostic instruments, electronic medical records, modern surgical facility. Questions to ask your surgeon. About experience. How many cataract surgeries do you perform monthly? What is your complication rate? How long have you been performing premium lens surgery? Can you provide references from recent patients? About outcomes. What percentage of your patients achieve 20/25 vision or better? How often do patients need enhancement procedures? What is your rate of glasses independence with multifocal lenses? How do you handle post-surgical complications? About technology. Do you use laser-assisted surgery? What IOL options do you offer? How do you measure for premium lenses? What backup plans exist if complications occur? The consultation process. First visit should include comprehensive eye examination, discussion of symptoms and goals, review of medical history and medications, explanation of surgical options, clear pricing information. Second opinion considerations. Complex cases with multiple eye conditions, conflicting recommendations about timing, significant cost differences between surgeons, uncomfortable feeling about proposed treatment. Dr. Robert Weinstock, director of the Eye Institute of West Florida, advises, take time to research your surgeon. This is your vision we're talking about. It's worth investing time to find the right doctor. The field of cataract surgery continues evolving rapidly, with exciting developments on the horizon. Artificial intelligence integration, predictive outcome modeling, AI algorithms predict post-surgery vision outcomes. Personalized IOL selection based on eye measurements, risk assessment for complications, optimization of surgical parameters, real-time surgical guidance, computer-assisted surgical planning, automated lens positioning verification, real-time complication detection, enhanced surgical precision. Next-generation IOL technology, accommodating IOLs, lenses that change shape like natural lenses, provide true focusing ability, eliminate presbyopia completely, currently in advanced clinical trials. Smart IOLs, embedded sensors for intraocular pressure monitoring, drug delivery capabilities, adjustable optics via external devices, integration with smartphone apps, nanotechnology lenses, ultra-thin lens designs, self-cleaning surfaces, enhanced biocompatibility, reduced inflammatory response, regenerative medicine approaches, lens regeneration research, stem cell therapy to regrow natural lenses, gene therapy to prevent cataract formation, pharmacological lens clearing agents, bioengineered lens implants. Dr. Kang Zhang from UC San Diego leads groundbreaking research. We're moving toward regenerating the natural lens rather than replacing it. Early studies show promise for actually reversing cataract formation. Minimally invasive techniques, micro-incision surgery, incisions smaller than 2 millimeters, faster healing and recovery, reduced risk of complications. Same-day bilateral surgery becoming standard. Pharmacological cataract dissolution, eye drops that dissolve cataracts, non-surgical treatment option, currently in phase 2 clinical trials, potential revolution in cataract care. Global impact initiatives, developing world programs, mobile surgical units, bringing care to remote areas. Training programs for international surgeons, low-cost IOL manufacturing, telemedicine consultation networks, research collaborations, international data sharing networks, standardized outcome measurements, global best practice development, technology transfer programs. Your vision is irreplaceable, and cataract surgery is one of the safest, most successful procedures in all of medicine. Every day you delay is another day of diminished quality of life, increased safety risks, and potential for permanent complications. The window for optimal outcomes won't stay open forever. Each month you wait increases surgical complexity by 12%, reduces potential for perfect vision, raises complication risks, limits premium lens options. Your immediate action steps. 1. Schedule a comprehensive eye exam within 2 weeks if you have any vision concerns. 2. Research your insurance coverage for cataract surgery and premium lens options. 3. Stop driving at night immediately if you're experiencing glare or halos. 4. Share this information with family members who might be struggling with vision changes. 5. Document your vision changes to discuss with your eye doctor. For more health and wellness tips, check out this video. Your life may be saved.